Hi, this is Dr. Bonillas. I will be showing a video on malar augmentation, otherwise known as cheekbone augmentation, using Juvederm VOLUMA XC, which is an injectable gel. It can be performed with little to no anesthesia and is actually very comfortable to perform in the office setting. I use a cold pack to numb the area where I will be injecting, as shown here. I then inject the Juvederm VOLUMA right into that malar region, which is essentially right on top of the cheekbone, and this provides a nice augmentation and fullness to this area. I then shape and mold the Juvederm VOLUMA into that cheekbone region to provide a nice shape and fullness to the cheekbone. I then continue to inject the VOLUMA until I get the desired augmentation, and I further shape and mold the product into the malar region. I then perform the same technique on the opposite side, providing a fullness and an augmentation to that side. And again, I shape and mold that product to the cheekbone. Again, I continue to inject to provide the fullness and augmentation to the cheekbone area until the desired augmentation is reached, and I continue to shape and mold. You can see that this procedure is not very painful at all, and no anesthesia has been used other than a little topical icing to provide some numbness. Again, here I'm continuing to inject, shape, and mold this cheekbone area until the desired shape and augmentation is achieved, and also until symmetry to the opposite side is also achieved. Sometimes I have to go back and place more product into the contralateral cheekbone until the desired effect is achieved. After all the product has been injected, I then ice, shape, and mold the product right into that cheekbone area until the desired cheek shape and augmentation has been reached. At this point, I continue with the icing. I then apply some soothing cream over the areas, and I continue to shape, mold, and massage out these areas to avoid any sort of lumps or bumps that may result from the injections here. And then I continue to shape and mold. And here's the final result of the procedure. Here's an example patient that underwent this procedure using a total of 1 cc or 1 syringe of Juvederm VOLUMA XC, and it shows the before and after, showing a nice correction of that malar region and a nice overall elevation of the mid-cheek junction and fullness to that mid-cheek junction. Well, this concludes this demonstration. I hope I was able to show you how this product can be used to shape and augment the malar region, otherwise known as the cheekbone region, and how comfortable it can be done with little to no anesthesia. And the results can be relatively long-lasting. Thank you very much for watching, and see you next time.